All right, everybody, welcome back to the Sarah Centrella Show. This one's super exciting because it has been a long time since I've had a guest on the show. If you are subscribed to the show and have been listening for a while, you know, I took a bit of a hiatus and then did some solo episodes. And so I am really, really excited about today's conversation. We had a podcast that just came out on her show that was amazing. And I was like, girl, I got to get you on mine. So we got to have this conversation. Welcome to the show, Dr. Patil-Sisodia.
Thank you so much. And Sarah, I'm just so excited to be here on your show. Like I said on my podcast, I don't think I knew the gravity of who I was sitting next to at that wedding in Mexico where
You're
we
so
met.
silly.
And it was just such a lovely instant friendship. Like when you
Instant.
meet somebody and you just feel their
Yes.
warmth and you just know that
Yeah.
your personalities are meshing, right?
Oh
So
my God,
I
totally.
I am so excited that I met you and we get to collaborate in this way. And I feel like it's just strengthening our friendship over
Yeah.
time. So yeah,
And this,
I'm pleased to be
everybody,
here.
this is so great because Como and I met on a vacation to Mexico for a joint friend's wedding. So we'd never known each other before,
Yep.
and we literally sat next to each other maybe at brunch or something. I don't
Yeah.
even
I
remember.
think it was
And
actually by the pool,
yeah, by the
right?
pool, and just started talking and had this, like you said, just immediate connection. And ladies who are listening out there, I think like when you meet
Yeah.
another chick who like gets you and you have that kind of connection, like put the effort in to make it a friendship. And you and I have both done that ever since.
Yes.
Like we
Yes.
both put in that effort. We text each other, we check in with each other. And what a special thing that is because it's so rare. I mean, truly, it is
Yeah.
rare. Rare
It's
for that to
really
happen.
hard to make friends as you get older, right?
It
Because
is.
I remember, college, you're surrounded by a whole pool of new people. And then for me, when I went to med school, it was a whole new pool of new
Yeah.
people. I actually met my best friend on the first day of med school. We walked in dressed in the same outfit down to the shoes, and I was like, "Oh, I'm either going to really like you
Right?
or
Or
we're going
hate
to be
you.
enemies." Right, exactly. But we've been friends for 25 years.
I love that.
But after that, it's like those key friendships in your life just space out more and more and more,
So
and
true.
it's really hard.
Yeah.
It's really hard.
It's so funny, and I don't think he'll mind me saying this.
No.
So you're really good friends with my now ex. Everyone on
Mhm.
here knows our love story. And so I asked him like immediately, I was like, I really love Como. Like, can I keep Como? And he was like, of course, I think like,
Yeah.
and you said the same thing. And I think like that just shows both of your character and what
Thank you.
amazing people both of you are. And I was like, oh, because it
I
is
love
true.
that.
You don't kind of meet that connection all the time. So, and women tell me this a lot. So that's why I'm reminding you if you're listening
Yeah.
that you do have to put the effort in. It goes beyond just that nice little conversation that you have at a pool or
Yeah.
in line at Starbucks or whatever. You have to actually exchange numbers and put effort in to advance the
Yeah.
friendship. So, I think we're a great example of that, but
Look at us.
I know, glow up. So we have so much to get into today because I actually want to start it off with the conversation that you and I first initially had.
Yeah.
So I met you, I feel like maybe after the pool, the next morning or something.
Yeah.
The first morning that we got there, I was in line getting coffee at the hotel coffee place. And I was crying. I couldn't stop crying. And I was like, this is really awkward. Like, I'm just meeting my guy's best friend. Like, this is so weird. So I kind of felt like I had to say something because like here I am just like
Yeah.
sobbing, and so I confided in you that my brother had just passed like the day before.
Yeah. Yeah.
And it was still something that wasn't public and we weren't going to make public. And so at that time, and it was just your empathy and openness, and you were like the only person that I told on that weekend on that
Yeah.
vacation, other than my guy. Obviously, he knew, but and it was just. I just really want to thank you for that, for
Oh, of course.
being there and listening, but then also you said some really important things because my brother died of an
Yeah.
instant massive heart attack at 46 with like no warning signs. And that's when you're like, well, I'm a doctor and here's some, and we
Yeah.
just kind of started talking about the health part of it. And I
Yeah.
was like, oh my God. And there was
Yeah.
so much that you told me about women's health that I had no idea
Yeah.
at all about. and it kind of shook me in a good way
Yeah.
because, you were talking about the fact that women in perimenopause have higher risk of heart disease and heart attacks and
Same.
all this
Yeah.
stuff. And I was like, wait, what? I've never heard that. So
Yeah.
you were really impactful in me when I got back home, just going and getting all of my tests and all
So
of that. So
glad.
we're going to get into all
Yeah.
that. But that, so everyone knows, is was very personal for me. And one of the reasons I absolutely want to have you on the show because
Thank you.
you made me go take care of myself and just made me know more about my body and what is going on. And I was kind of shocked at how little I knew, if that makes sense. And I feel like I
Yep.
might not be the only one. So ladies,
You're
this
not.
episode is for you.
Yeah. To all the ladies out there who are wondering if it's in their head or they're feeling like they're being gaslit, that's why I have kind of shifted my career a little bit to getting more into women's health. So just for
Yeah.
everyone who doesn't know me, I'm Komal Patil-Sisodia. I'm a board certified endocrinologist, obesity medicine specialist, internist, and then last year I became a menopause society certified practitioner
Mhm.
because my road to medicine has been kind of an interesting one. My mom, my senior year of high school, had I think it was an 80% blockage in one of the
Wow.
coronary arteries in her heart, right? And at the time, she was 42 years old.
Oh my God.
No real risk factors, right? And there was actually a delay in diagnosis because, like the year prior, she was having difficulty walking up our driveway, and
Mm.
the slope was like this, right? So it's not like
Yeah.
super steep. It's not like you're trekking up a hill. And you live in Portland, and I live in
Yeah.
Seattle, and they're both really hilly cities. So I think we have a pretty decent tolerance for when we're up and walking around and doing all of those things. So she was getting short of breath just walking up our driveway.
Wow.
And, at that point, like it did not register to anybody that this woman could be having heart disease, right? So there was a delay in
Mhm.
diagnosis. And I remember it clearly because it was like around college application time for me, my senior year. And they found out that she had this blockage. And at that time, heart stents weren't, I don't think, where they are right now. So
Mhm.
it wasn't like the therapy that you did. So she actually underwent open heart surgery
Oh my
at
God.
42
Ah,
to have this area bypass. So she had a bypass at 42, and we
wow.
thought everything was good, but I really see that as the turning point in her life to where all these health issues snowballed and it kind of went sideways, right? So she ended up having that graft that they did close off in 2 years. And the other crazy part was the impact of the surgery. Like when you go through open heart surgery, they basically split your sternum in half to open up your
Jeez.
chest,
Oh my
right? And
God.
that never really healed well for her, right? So she's had chronic discomfort just from that. Then the graft reoccludes, and everybody's scratching their heads thinking, good Lord, like what is going on? And so then they finally did all this cholesterol testing for her, and she was found to have an elevated genetic cholesterol particle called lipoprotein little a. And
Mm.
this is something, and we'll talk about another one like
Yeah.
towards the end of the podcast, but these are the things that we don't necessarily screen for in women, and heart disease in women presents very differently than it does in men, right?
Mm.
So this kind of it was always in the back of my mind. And then my parents are immigrants to this country. They came in the mid 70s. My mom was newly married. English was not her first language, and she learned how to speak English, but navigating a healthcare system was really hard for her. And at this point, I wasn't a doctor, so I don't
Right.
have the tools or the capability to do anything. And I'm just kind of watching her on this trajectory, right? So she's going through all these health issues. And then probably my first or second year of med school, I was home and she had, when the graft reoccluded, they had to put in more stents and,
Oh
so she
God.
was kind of doing better, but following with a cardiologist. And I think one of the things that I'm most excited about now is that there are more women going into medicine. Actually, like 4 years
Mm.
ago was the first time more women enrolled in medical school than men did, right? It was like
Wow.
50.1 to
Yes,
49.9% or
girls,
something
let's
like that,
go.
right? So I think to there have been generations of women who have been gaslit in their experiences because
Mhm.
they had healthcare providers who didn't really know what it was like in their bodies, right? I always tell all my
1000%.
patients, women have more hormone shifts in a month to have one period than most men do in their lifetime, right?
Wow.
For men, it's a much more gradual decline of testosterone with age. With women, it's like our ovaries stop working and it falls
Yeah,
off a
and
cliff,
all of a sudden
right?
you're like, what is wrong with me?
Yeah,
Everything is wrong
exactly.
with me.
And everybody thinks it's in their head, right? So
Hmm.
I was with her at this cardiology appointment and one of this was like a key moment in my career because she was in the office and we walked in to see this doctor and my mom's so excited. She says, "Dr. So and so, this is my daughter. She's in medical school." And this guy just kind of looks at me, side eyes me and says, "Oh, I'm sorry."
Oh
Right.
my
And I just thought like, oh my, like red
God.
flag number
Yeah, you're
one,
like, can we get a
right?
new doctor real quick?
Yes, right. And it just got worse from there, Sarah, right? So they talked for a bit. He was not really engaging with me at all, which is fine. I'm not the
Yeah.
patient. I'm not there for a visit. But then she said to him, she said, "Doctor, can you please explain to my daughter what my heart condition is? So when we get home, she can explain it to me in our language."
Yeah.
And this guy, I have never wanted to throat punch somebody so bad in my entire life. He
Ugh.
said to my mom, "I have explained it to you so many times. It does not matter what language you hear it in. If you haven't understood it by now, you're not going to understand."
What?
Right, right. And
Oh my
so
God. Bedside
in
manner
that
much?
moment, I was like, don't throw punch him, don't get kicked out of
Oh
medical school,
God. I might
right?
have.
It was very tempting because
Yeah.
like that's not the type of empathy that you need to meet patients with. So for me
No.
personally, that was kind of the turning point in my career was like, most people who are coming into my office are suffering. So I'm going to believe what you say. Even if I don't
Yeah.
have an explanation, I'm going to believe what you say and do my best to try and figure out what is going on with you. And even if I'm not the one to fix it, if I get you to the person who fixes it, I've done my job,
Yeah.
right? If we've exhausted all of those options. So for me, it was like, okay, never going to be like that guy. I'm going to try and advocate for my patients, right? And I go down this path of, becoming an endocrinologist. And I remember when I was in my fellowship training, my fellowship program director, the Women's Health Initiative study had been released like maybe 4 or 5 years prior.
Hmm.
And it had created all of this crazy of, oh my gosh, hormones are bad for women. Hormones are
Yeah.
going to cause cancer and heart attacks. And, it was crazy. Like I even did this thing for one of my own podcast episodes where I pulled the news headlines from then. And then they actually reevaluated all of the data in that study in 2024 and said, we
Yeah.
might have overreacted a
Yeah.
little. And you
Yeah.
look at the difference in headlines, and it's like a true study in media because it was hysteria versus
Hmm.
something that's more balanced and gives women options, right? So for 2 decades, we ended up kind of ignoring it. But when we were reviewing that particular study, my program director said something really interesting to me. He said, this is really going to affect women's rights. And
Yeah.
I kind of looked at him and I said, "You mean women's health?" And he said, "No, women's rights." Because, and this may
Hmm.
be a divisive statement to some, but I am very
Yeah.
pro-choice for women
Same.
having
Same.
autonomy over their bodies.
Yeah.
But he said, we're about to take hormones away from the women who fought for Roe versus Wade. We're not
Mm.
going to give them to the next generation. And if and when, not if, but when Roe versus Wade goes back to the Supreme Court in your lifetime, you will see it overturned, right? This is
Mm.
2007 that he's saying this. And I'm
You're
thinking, oh
like,
my
that'll
gosh,
never happen.
no, our rights are
God.
secure,
Yeah.
all of that. But then, June of 2022 rolls around and I
Hmm.
start thinking, oh my gosh, right? He wasn't
Yeah.
wrong. It was kind of almost like an oracle reading into the
Right.
future. And that was kind of around the time that I was starting to hit perimenopause, right? And
Mm.
I'm as much a doctor as I am a patient, right? And I want people to hear that because the thing is that doctors don't live these perfect lives. We're all
Mm.
susceptible to the same genetic things that run in families, the same things where your environment may not be optimized, right? Like we
Right.
live very stressful lives. If I detailed to you my residency training, you'd be like, "Oh, girl, you were
How'd you
not
live
doing
through
anything
that?
healthy." Right, exactly. It was a lot of, overnight call and late night snacks, which is now we know is terrible for people,
Mm.
right? So all of these things kind of coming together, I was hitting perimenopause, and with my mom's heart condition, my sisters and I had been screened for heart disease since our mid 30s, or at
Yeah.
least I don't know if my sisters are doing it. I've told them to, but who knows,
We hope.
but I have,
Yeah.
right? And in my like pre-pandemic, I was kind of in this thing where like, okay, I need to lose the baby weight because the baby's not a baby anymore,
Yeah,
and I
feel
need
ya.
to get myself healthy, and I'm going to do all of these things. And so I did all of that evaluation for the lipoprotein little a. I had a CT scan of my coronary arteries just to make sure they were clean because I was like 35. I'm like 7 years out from
Yeah,
what happened to mom. I should be checking, right? So we do all of the tests, and my CT is perfect. My lipoprotein little a is in a normal range or not in a high risk range. And, I do all these things. I lose 40 pounds on my own diet, exercise. I'm
amazing.
trying to
Yeah.
optimize all my lifestyle things. And then I hit 44 last year and I thought, I just have this nagging feeling. I don't know why.
Yeah.
Call it intuition, call it whatever. And I was like 2 years past my mom's age for where she had this. So I said to my primary care doctor, I was like, I need you to check that lipoprotein little a again. And she was like, why? And I
Wow.
said,
Intuition,
because
man.
the current data says you check it once, and if it's normal, you leave it alone. You never check it again, right? And so then
Wow.
I said, you know what? Just check it for me. And sure enough, it had gone from like low 60s up to 98, and over
Wow.
75 is considered high risk. So I'm freaking out, right? Because I have
Yeah.
spent the last 4 years optimizing my health,
Trying to
trying
get
to do all these things.
everything. Yeah.
And this is not in my hands, clearly, right? If I've done all these things. And
Hmm.
so I was freaking out. And then I was like, okay, I had my freak out and I was like, okay, go back to your calm headspace. Let's like
Yeah.
intellectualize this, try and rationalize what may be happening. And the only thing I could come up with was, maybe it's because I'm in perimenopause, right? Maybe that's
Yeah.
what it is. And so I went back to my mom and I was like, hey, do you remember how old you were when you went through menopause? Was it early? What happened? She said, well, I don't know. I had a hysterectomy in my 30s. And I said, wait a minute.
Yeah. Yeah.
She's like, I had a hysterectomy after your youngest sister was born. So that would have been around 32. And now looking back at the data, I know that, and we all know that when women have a hysterectomy, they will on average go through menopause 4 to 5 years earlier, even if you leave the ovaries behind,
Okay.
right? So menopause is defined when like your ovaries stop ovulating and you stop having a period. But for
Yeah.
women who've had a hysterectomy, you lose that marker for knowing when you're going to go
Right.
into,
Right.
right? So she had that at 32. She could have hit menopause by 37 and then had heart disease by 42, right? So in my mind,
Right.
I'm thinking, good Lord, like, is this what's happening? Went back, started reading the data around lipoprotein little a, and it doesn't really respond to statins. It doesn't really respond to diet and exercise. But there were some studies around the time of the Women's Health Initiative that showed that it actually did respond to estrogen therapy, hormone
Okay.
replacement therapy, right?
Yeah.
So this was like my moment where I was like, crap, I'm a hormone doctor and they didn't give us much
Yeah.
training in
Yeah.
this, but I'm going to be like a staunch advocate for women, right? One, our rights are on the line. Two, I
Hmm.
watched my mom suffer through this. Three, I despite me trying to basically like
Yeah.
problem solve and control every angle. There are things happening in my body that I don't have control over right
Yep.
now, but I know that there are options that are out there. So that was kind of my jump into all of this. And over the last, it's what now, 2025? So 3 years,
Yeah.
I've become a very staunch advocate for women, at least one, being educated on what their options are, right?
Yeah. That's
Understanding
huge.
their family history, understanding their personal history, and then understanding how menopause is going to impact their lives and potentially bring some of the things that are coded in
Yeah.
their family history out. And then how do we start screening you for that so you can have like the best number of healthy years into the future?
Yeah. Oh
Yeah,
my God.
right?
I love that, and thanks so much for sharing your personal story because, all of us have health
Yeah.
histories in our family, and my father and my grandfather both had heart attacks. So I kind of thought that number one, I thought it would only run in the men's line. So I think my brother
Yeah.
probably knew that, it was a risk factor, but his stuff had checked out prior as well. So I didn't ever really think anything of it at all
Yeah.
because I was like, oh, well, those are the guys that have had it, so I don't have to worry about it. But then after our conversation, you're like, no, go get checked, and things can change when you're perimenopausal. And there's so much I want to get into right here
Yeah.
now. But the very first thing I want to say is maybe I was uneducated or just didn't know, but there was no communication with me from my doctor,
Mm,
from anything. It's just now starting to come up in my freaking social media feed.
Yeah.
So that's where I'm learning some
Yeah.
stuff now. But like literally, I have no idea when I started
Yeah.
perimenopause because like the only thing I was ever told is like when you stop having a period, then you're in menopause. Well, that hasn't happened and that's still normal. So I was always like, I guess I'm normal. So then all the symptoms that I've been having number one, most of them I didn't complain to my doctor about because they
Right.
were all ones that in my head, everyone was saying, oh, that happens when you get old. You're getting old.
Right.
You're getting stiff. Oh,
Yeah.
is it hard for you to touch your toes now? Oh, poor
Yeah.
kid. You're getting old. Like that's
Yeah.
been the thing with every single one of the symptoms that I've had. And so I figured since my period isn't done, I'm not in menopause. So like
Right.
I had no concept literally until like 3, 4 months ago that these things could be all part of it. And
Yes.
then when you and I had talked in Mexico and you're like, you should definitely take the test and you should get on some hormones. I was like, wait, what is hormones? What is this? And
Yeah.
I just feel so kind of like silly, almost uneducated about it. But I'm so grateful for you for really kind of like hand holding me, thank God, and
Oh, of
just like
course.
telling me
Yeah.
kind of, hey, you're not crazy. The fact that you haven't slept or that you sleep like 3 hours a night for the last
Yeah.
like 7 or 8 months and
Yeah.
why, like you're weepy for no reason and just like all these
Yeah.
things, definitely the stiffness, hair
Yeah.
loss. Oh my gosh, the list literally goes on and on. I think I read that there was like 80 some odd
Yeah.
symptoms of
There's a lot of
perimenopause. I was
symptoms.
just like,
Yes.
oh my God, I had no clue that these things were related
Yeah. And the reason
whatsoever.
Yeah, and the reason for that is that we have estrogen receptors pretty much everywhere in our body from head to toe, right? So, what symptoms affect you versus what affects me versus what affects the next woman walking down the street, it's all going to look a little different depending
Mm,
on what your family history is, like what your personal history is, and how all of these things come together, right? And
yeah.
that I think is the piece that women are not educated about, right? We think that I had a woman in my office, gosh, I don't even remember when now, but she said, I just want my ovaries to do what they're meant to do, right? And the sad truth is our ovaries are programmed to die. I know that sounds
Hmm.
harsh,
Yeah.
but they are, right? We
Yeah.
as women are born with a set number of eggs in our ovaries, right? Like when we're conceived
Hmm.
in utero, we have maybe like 12 million eggs, right? When
Yeah.
the ovaries form. By the time we're born, it's like exponentially decreasing. I think you're down to 1 million by the
Wow.
time like you're born, somewhere in the millions range. And then you hit puberty and you're in like the 500,000 range. And then you hit your peak reproductive
Yeah.
era and you're down to like 300,000, right? And it's
Yeah.
variable, obviously,
Right.
right?
Right.
Like there are some women who are like super fertile and others who have issues. And so there's always a spectrum,
Yeah.
right? But as the ovaries, in order to ovulate, what your ovaries do is they kind of signal back and forth with your brain in order to produce what we call a fertile follicle or an egg that can be fertilized,
Yeah.
right? Yeah. And then that gets released. But your ovaries have to kind of do this pattern of estrogen release followed by progesterone release. Your brain is coordinating it with two other hormones, and it all has to kind of work perfectly in sync in order for you to have a
Mm.
period, right?
Okay.
So what happens is that you have that monthly cycle, but as the egg counts start declining, when you hit perimenopause or, when your fertility is starting to decline, which depending on your age, background, ethnicity, all of those things can start as early as like mid 30s actually.
Okay. That's what I was
Um,
gonna ask. I was like,
yeah.
what's the range? Yeah. When
Yeah, mid
perimenopause can
30s.
start.
I think like women who are of Asian descent tend to be a little bit earlier, Southeast Asian
Hmm.
descent in particular. But 40 is kind of that time where I now my standard practice, even if they're like coming to see me for like a thyroid nodule, which has nothing to do with
Yeah.
perimenopause, I'll be like, "Hey, so you're over 40, and I'm going to give you a TED talk today in my office about why you need to care and why you need to ask questions,"
I
right?
love it though because doctors don't do that. Like there
Well,
wasn't one time that my regular doctor who I've had for
yeah,
16 or 17 years, so
yeah,
not like a minute,
yeah.
uh there wasn't one time she asked me a single question
Yeah,
about any perimenopause stuff. And then after you and I talked, I was like, "Hey, I want hormones." She was like, "Well, you still have a regular cycle. So
yeah,
come to me when you're 6 months post regular cycle." And I was like, "This is not fucking helpful."
No. Well, and I think that that speaks to the impact of the Women's Health Initiative study that was done in the early 2000s, right? And this ripple effect that it's had on medical education. So basically, the way that I explain it to people is that, and the way that my program director explained it to me back in the day is that as your ovaries start decreasing their production of estrogen over time, Mother Nature is like, yeah, you're not
Yeah.
really contributing to the gene pool anymore. So all if you overlap the natural history of aging in women, all these chronic diseases start to rise. And my program director was like, he's like, it's, and this is a very crass way of
Yeah.
saying it, but um, uh, basically Mother Nature's trying to
Yeah.
off you because you're not contributing to the
Yeah.
species anymore, right? Which is a horrible way to think of it, and it has no bearing
Yeah.
on like
But
what
that kind
value
of
we bring as
is
humans.
the
Right.
way,
But
genetically, if we go
biology.
back, yeah, the biology of
Yeah.
it. Yeah.
Biology.
It was like produce or
But
else.
right, exactly. And so, one of the things is that if you're going to intervene and potentially blunt the impact of things that may happen anyways because of our genetics, you may want to intervene sooner with hormones, right? So if you're starting to have symptoms and your blood pressure is rising, your cholesterol is rising, your blood sugars are rising, that's likely the appropriate time to intervene to blunt it. The Women's Health Initiative, and so that's somewhere between like 40 and 55.
Hmm.
The women in the Women's Health Initiative, average age was 63, Sarah, right? So we're
Jeez.
right, we're a decade too
Yeah.
late, right?
Yeah.
And so the other
Or
thing is
more.
right, exactly. So they recruited women into that study who were aged 50 all the way up to 79, right? So this
Wow.
study is
Okay.
giving like 79-year-old women hormones and like
Yeah.
everything in between. And so when they initially released the results, there were two arms of the study. One, which was estrogen plus progesterone, and that is for women who have their uterus. When you have a uterus, you have to take progesterone because progesterone protects your uterine lining and prevents endometrial cancer. If you
Okay.
don't have a uterus, you don't have to take progesterone. And you can be on estrogen alone. So they have these two arms of the study running. And in the estrogen plus progesterone arm of the study, they started to see this slight uptick in heart disease and cancer and everything. So they just stopped. They stopped both arms of the study. They put out this data that said hormones bad, right?
Yeah.
And it freaked everybody out. But then what they should have done when they initially released the study was kind of age stratified it, which they did do 3 or 4 years later. And what they actually saw, and this wasn't advertised as much, was the women who were 50 to 59 actually had benefit. And then that
Yeah.
slight uptick in breast cancer that they had, when they followed those women long term, there was no difference in outcomes. There was a higher
Okay.
rate of getting diagnosed, but what we call the mortality or the rate of
Right.
death, that had not changed. The morbidity, which is all the
Yeah.
complications, that had not changed, right? So there's a slight uptick, but overall, they're doing better in all these other things, right? So we
Yeah.
misinterpreted and misapplied the data to some degree. And so that actually just stopped hormone education in medical education. It stopped people questioning what was happening, right? And so
Right.
it was like all of a sudden we all collectively became ostriches and we were like menopause, la 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 la,
Yeah.
right?
Yeah.
And it just wasn't a thing that we talked about. And so I think what's happening now is like women like me who are
Yeah.
physicians, we're hitting perimenopause and we're going, oh hell no,
Wait a second. What the
this
hell's going
cannot be the
on?
best it's going to get,
Yeah.
right? Like time out.
Yeah.
What's going on? And there are some really incredible women in this space who are out there and advocating, right?
Yeah.
And the thing is that we still don't have enough data, so it's almost like we're opening up to trying things to improve our quality of life. We're
Yeah.
going to need longer term studies, but I how those happen and whether those happen and complete in our lifetime, who knows, right?
Yeah.
That and the other sad thing is that women were not included in medical studies until 1993 because
That's
our
crazy.
periods make it, our hormonal
Yeah.
fluctuations make it too hard to track. Like there's a multitude of reasons. There was a study that happened several years ago, several decades ago, where the drug that was used caused birth defects, right? So for a multitude of reasons, women were just like not included in medical studies. And then even like some of the mouse studies that they've done, they remove the ovaries of the mice and then study the female mice.
Oh my
Well, that's
God.
basically
Yeah.
you're only studying it in menopause, right? Like we're not
Yeah.
taking into account any of those things. So I think it becomes very difficult to study women, but at the same time, there are some things that we know to be true, and we can help people make decisions that are going to give them autonomy over their bodies and also
Yeah.
the option to exercise some of these things because 80+% of women have symptoms of perimenopause and menopause and they're not offered any help, right?
Yep.
And because you're still cycling, I think it's really hard for people. They're like, oh, it's not a problem because you still
Yeah.
have a cycle. But the
Yeah.
thing is that during that time when your fertility is declining, it's what people call hormonal chaos, right? Your ovaries are trying to biologically get you pregnant. So they're just kind of randomly firing off eggs. And
Yeah.
so your cycle becomes irregular. Sometimes they lump on top of each other and you get this like extended period. It is all over the map, right? And
Yeah.
this is why checking your hormones during perimenopause when you have a period, it doesn't really tell you much, right?
Yeah, well, I was just gonna say, like,
Yeah.
when I went to my doctor to get all my tests done, maybe
Mhm.
a month or so ago, I had all my heart stuff done, which was
Yeah.
great, and all those numbers came back,
Yeah.
actually better than they ever have in my whole
That's
life. Which,
amazing.
yeah, they all were in the normal range. But what was also in the totally normal range was all of my hormones. And
Mhm.
so when I first asked my doctor after we did the
Yeah.
test, I was like, "Hey, I really want some hormone therapy, like the HRT patch, or I want something."
Yeah.
She was like, "Well, your hormones are normal. So not only like do you have a regular period, but your hormones are normal, you're fine, you're not going through anything." And I'm like, "I just
Yeah.
turned fucking 50. Like, I've got to
Yeah.
be going through something for Christ's sake, right?"
Tell me what it is.
I was just like, Jesus Christ. And then as soon as I learned what some of the symptoms were, and I was like these aren't light symptoms. This is like, I can't sleep
No.
because of the pain. I can't sleep because of the hot flashes. Like,
Yeah.
you know, literal hair loss falling out in clumps, like back, just all this stuff. And so I finally, thanks to you, like there's a test, like maybe you can share the link or whatever that's
Yeah. I
online that I'll put in the notes, but that you kind of walked me through to just check and see like what some of those symptoms were.
yeah.
And I was like off the charts. And so I finally said that to my doctor, and literally
Yeah.
today she filled the prescription. I was like,
See,
yes.
that makes me so happy, right? So we don't have a lot of validated tools for menopause, but one that we do have is called the Green Climacteric Scale, right? So when you were telling me that you had talked to her and she wasn't giving it to you, I was
Yeah.
like, you know what, girl, we're going to do this screening online. You're going to take that score to your doctor, and then we're going
And
to
I
go from
did, and
there.
she
So
finally took me seriously. I was like,
yeah,
these are the severe symptoms that I'm having, and they all
yeah,
track. Like,
yeah.
come on, man. Yeah.
Exactly. And so I'm actually going to pull up the green scale so I can I can read some of them to the listeners because are a lot on there, even that I as a physician was very surprised by in terms
Yeah.
of symptoms because it would not have been something that I would have put in
Right.
like, oh yeah, this is definitely a symptom. And so it's been a great learning curve for me. But now my practice is to make sure that I do this scale with my patients so that we can figure out like how severe are their symptoms, and then we have a way to track them, right? Because that's
Mm.
the other thing. Like you start somebody on therapy, and most medical conditions like you can check a lab or like
Yeah.
cholesterol. I put you on cholesterol medicine. If your cholesterol doesn't go down, I know it's not working,
Right.
right? But what
Right.
do you do in menopause when or perimenopause when all the hormones are normal even though you're having a ton of
Yeah.
symptoms? You have to track your symptoms, right? So this scale called the Green Climacteric Scale, I'm going to read there. It's 21 questions, and you rank the symptoms none, mild, moderate, severe, and it's scored out of 63. And anything like 12 to 15 over 63 out of 63 is considered symptomatic, mildly
Hmm.
symptomatic, but symptomatic. And anything higher, like that's
I was
moderate
like
to severe
35.
symptoms. Yeah, it was high, right? You were
Yeah.
up
Yeah.
there. And
Yeah.
I've seen people come into my office who have scores in the 50s, right? And it's like, you don't have to wait that long, attain that degree of suffering in order to get help, right?
Yeah.
So if you're doing this and you're noticing that you're having symptoms, go ask for help,
Yeah. And
right?
that was the frustrating thing for me is like, oh my
Yeah,
gosh, like, could I have gotten help 5 years ago? You know what I mean? Like that, and that in a way like pisses me off.
yeah,
It's like,
yeah,
where was the education? Like, why was nobody talking about this? Like, Oprah
yeah,
did a special not long ago that
yeah,
actually was the first one that I learned a lot about menopause because it was a
yeah,
full-blown like two
yeah,
hour menopause special. I was like, oh, interesting. And that's
yeah,
where I learned about the HRT patch and stuff because
yeah,
I was like, if I could have had that 5 years ago, not only would I not have had so much of like the pain and numbness and just all this other stuff that I've been
Yeah.
going through, but like, ladies, like, what about your skin?
Yeah.
Like, I'm like, I literally
Yeah.
went to my esthetician. I'm like, what is going on with my neck? Why am I getting crepey neck? She's like, it's because you don't have whatever the hormone is.
Yeah.
I don't know
Estrogen.
the
Yeah.
difference between the two. And
No,
she was
no,
like, it's
that
because your estrogen is declining. And I was like, what the fuck? If I could have had this 5 years ago,
it might
I'm
look
so
different, right?
mad.
No, but you are beautiful and fabulous. And so, but I think we're our own worst critics, especially when we're in front of Zoom cameras and
Right?
staring at our faces all day. And, you live a very public life. So, right, we're
Yeah.
going to nitpick all these little things. But
But
really,
I'm
like
just
this,
like, there's help
yeah,
out there, man. There,
there,
yeah. So
there is.
read through some of those symptoms.
Yeah, I
Yeah,
will. I'm
share
going to
some of the
read through
symptoms.
through the list really quickly. So it would be things like if you're whether your heart is beating quickly or strongly, whether you're feeling tense or nervous, whether you're having difficulty sleeping, whether you're excitable, meaning like the smallest little thing sets you off, panic attacks, difficulty concentrating, feeling tired or lacking energy, losing interest in a lot of things, feeling unhappy or depressed, having crying spells, being irritable, feeling dizzy or faint. And then there's some that those kind of made sense to me, but then it was like pressure, or tightness in the head or body, or
Hmm.
feeling numbness, tingling in certain
The
areas.
numbness tingling thing is
Right?
crazy because I literally thought I was having a stroke because it was
Yeah.
all like the left side of my body.
Yeah.
Like my legs would fall asleep, my arms would fall asleep at
Yes.
night. They would tingle so bad that like they'd feel
Yeah.
like they're on fire. And I'd be like, I must be having a stroke because that's the only thing I can think of like when your arm goes numb.
Right.
And then I found out it was one of the symptoms. I was like, oh my God.
Yeah, I mean, and it's crazy, right? Like Dr. Vonda Wright wrote this great paper last year called The Musculoskeletal Syndrome of Menopause, and it talks about the impact of estrogen on our joints and muscles and ligaments and tendons, and,
Yep.
muscle and joint pain is a
Oh
very
my
common
God. That's probably
symptom,
my
right?
number one. That is my number
Right.
one.
Yeah.
It is extreme, like
Yeah.
to the point where I have to take like Advil to do my morning workout class. Like
Yeah.
I can't do an upward facing dog
Yeah. And I
until
mean,
until my body's
it's
warmed up like 45 minutes later. It's like,
plus
Jesus,
ibuprofen,
what
right?
is
Exactly.
happening?
Yeah. And it's hard, right? Because you don't realize because the creep of these symptoms is
Yeah.
so slow over time. And one of the cool things about being a human is that our bodies and our minds are very adaptive, right? So
Hmm.
sometimes we almost gaslight ourselves into being like, okay,
Yeah,
is it
again,
not
I just
that?
thought it
I
was
guess I'm
just
just getting
you're getting
older.
old.
Like it's
Like
not,
literally that was what I
yeah,
thought and is
yeah,
what everybody tells you. Oh, that's
yeah,
just a sign that
yeah. And
you must be getting old.
exactly. And then the major symptoms that we talk about, well, there's disrupted sleep, which I think is now just coming into its own. You guys have an amazing sleep specialist in your area who is focused on helping perimenopausal and menopausal women. Her name is Dr. Andrea Matsumura, and she's going to be opening a menopause-based sleep practice soon. So I'm going
Nice.
to just throw a plug in for my
I
girl,
might
Dr.
need to call
Matsumura.
her up because my sleep situation is not okay.
Yeah, yeah. And she's fabulous, right? And she was on my podcast and we talked all about like the different things and hormones are a piece of it, but a lot of it is just disordered sleep
Hmm.
from life, right?
Yeah.
So kind of you have to work on all the things in order to see the benefits. The hormones are not going to be the magic bullet for
Yeah.
everything, right? Because there is normal aging, there's symptoms of menopause, and then there's like stuff that's in your genetics that's going to happen to you no matter what, right?
Right.
And what is truly like we're never going to feel the way that we did in our 20s, right?
Yeah.
We're just not. That's life.
Yeah.
And you have to be realistic in what your expectations are. But could I be better than I am today? Could I feel
Yeah.
better than I am today? Yes, right? What does
Yeah.
that look like? Even a 10% improvement for a lot of women is a pretty big improvement,
And I
right?
gotta say that just recently,
Yeah.
as it always is, right? Whenever
Yeah.
something is in your head, it shows up everywhere. I've had probably three conversations in the last week and a
Yeah.
half with women who just started taking it. So just got their
Yeah.
patches within the last like two
Yeah.
months or so. And all of them are like, "Oh my God, girl, like I got my life back." And it's a lot of things that you think are never coming back. One is the brain fog,
Yeah.
um, and memory
Yes.
issue stuff. Like, so this
Yeah.
is again all the stuff that I didn't necessarily complain to my doctor about
Yeah.
because everyone said that's just part of getting old. And I'm like, oh my God, am I really getting that old already? Like, why
No.
did I put the keys in the freezer? Like, what's going on?
The other day, I
Like,
called my son into my office because I could not find my mouse on my desk, right?
yeah,
And I was like, well, shit, did I just go blind? Like, I can't see in it.
yeah.
I can't see it. And I would call him in, and he looks at me, looks at my desk, and then points to the floor. And he's like, it's on the floor, Mom. And then I was like, oh, I guess I didn't see it. And I went to pick it up, and he's still standing there staring at me. And he said to me, Mom, you are the person who finds what I cannot see in front of my face in the
Right?
fridge. Like, if you are starting to lose that superpower, we're doomed.
Yeah,
Like, we're
right.
just doomed,
Exactly.
right?
Yep.
And
Yeah.
and it's amazing, like all those little changes that happen. Like when I started on HRT, now it's
Yeah.
menopause hormone therapy is the appropriate term. So MHT. We I didn't tell my husband or my son that I
Yeah.
started it. And literally 3 days in, my husband came by and he's like, oh, you seem happier. And I was like, really? And he's like, yeah, just like less edgy.
Less irritable.
And I was like, was I edgy before? Because I think
Right?
I'm a bundle of joy.
I know.
And he was like, no, there's a difference. And even my son said the
Yeah.
same thing. He was like, you seem happier and you're a little
Yeah.
nicer. And it was just
Yeah.
one of those things that you don't even notice is happening.
Because the slide is so slow that
The slide is so slow.
you
Yeah,
just deal with everything. And I think
exactly.
women are kind of conditioned to just deal anyway. We're like,
Yes,
oh, just
we
suck it
are.
up, just deal with it,
Yeah,
get all the rest of the stuff you have done. Like, you're not dying, you're fine,
yeah,
type situation. But someone said something funny that I think is probably true. They were like,
yeah,
as soon as Gen Xers got into, or what am I? Yeah,
yeah,
Gen X, right?
yeah. Gen X, that's
Yeah, as
correct.
soon as Gen Xers got into perimenopause, they were like, where the hell is the fix for this
Yes,
shit? Because we're not
yes.
sitting around and just taking it. This is the generation
No.
that's like, fuck you, give me something.
Yes,
Like,
yes. And I strongly identify as a Gen X, but
yeah.
apparently by birth I'm technically a millennial. So
Oh,
I
you
think I'm
little
in that little
baby.
cross section of what we call exennials or geriatric
Yeah.
millennials, right? But it's so true because I feel like this is the group that is
That
not
is the
going to
fixers.
tolerate
Yeah. We're like,
the
no,
bullshit,
how do we
right?
fix
It's
it? Like, let's
exactly.
fix
So
it.
I think that this is going to be a good thing for women's health, right? And the thing is again, I want to put out there you don't have to take hormones if you don't want them, right?
Yeah.
But they
Yeah.
help with so many things. So if it's impacting your quality of life, definitely go seek help. There are 15% of women who feel no symptoms. They like roll on through and they're totally fine. Those women probably,
Yeah.
they might not need anything because they may have longevity built into their genes. They may not have issues with anything. And, but even with them, I would advocate for them if you're hitting a point where you're having symptoms, go ask for help, right? Because some
Yeah.
things can come much later with age, right? We talk about like the traditional symptoms like hot flashes, night sweats, increased UTIs, vaginal dryness, pain with intercourse. One of the biggest killer of older women is urinary tract infections, and they end up in the
What?
hospital in sepsis. Yes.
Oh my
And the
God. Had no
quick
idea.
fix for that, even if you don't, if even if you're not on an estrogen patch,
Yeah.
you can have vaginal estrogen, which is safe for most anybody. Even most women who've had breast cancer can
Yeah.
take this safely without worries for recurrence. There have been studies that have shown that, but that can prevent urinary tract infections where you're not going to die from a UTI when you're in your 80s or 90s because
Yeah.
taking vaginal estrogen and keeping your pelvic floor healthy. There's so many pieces to this that we can really change our quality of life and our outcomes on that basis, right? Like
Yeah.
I want to carry my groceries when I'm 80 and 90,
Amen.
right? And
Amen.
be as independent as I can be for however long I can be, right? So
Yeah.
these are tools that can potentially help you get there because we're fixing things. Now, there are a group of women who are not going to be able to take these medications, right? So if you've had what we call a cancer that has like a hormonal component to it, right? Like breast cancer, uterine cancer, endometrial cancer, ovarian cancer, your options are going to be limited.
Yeah.
But limited doesn't mean no options. There are non-hormonal therapies that help with the symptoms of menopause, right? And you can go talk to your doctor about those. It's not that there's no help out there. It's,
Mm.
and I hate that conversation of like, oh, hormones, 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 magic
Yeah.
bullet, magic bullet, magic bullet. It's not available to some women, and some
Yeah.
women don't tolerate it either, but there are other options, right? So you shouldn't feel left out. You should still be part of the conversation so that you can get to know what all your options
I
are.
love that. Real quick, what are some screens that you recommend for, I mean, kind of broadly, I guess, for women, let's say over
Yeah.
40?
Yeah. So
General health screens that we
yeah,
should be
general
taking.
health, my perspective as an endocrinologist is like midlife is kind of when, like I talked about before, when your genetics start to show themselves, right?
Hmm.
Like my mom had that thing. I did all the lifestyle things, but I couldn't outrun my genetics, right? It
Yeah.
it shifted at some point. So I always say a cholesterol screening, fasting blood sugar to evaluate for prediabetes. There's another test we call a hemoglobin A1C, which is like a 3-month snapshot of what your blood sugars have been doing over the last 3 months. That those two, the fasting glucose and the A1C, will help rule you out for prediabetes or diabetes. A standard cholesterol panel, and then there are two cholesterol particles that are associated with a higher risk of developing heart disease. And I
Mm.
think that we need more people to be screened for those. And those are the lipoprotein little a that we
Hmm.
talked about at the beginning of the podcast. And there's another one called apolipoprotein B, right? And
Okay.
that one can actually respond to statin medications, which unfortunately have gotten a bad rap, but are actually life-saving medications, right? So if you're doing all of these things, but your levels are not responding to diet or lifestyle changes or hormone therapy, you should be talking to your doctor about statin medication for what you can do to help treat that, right? I'm all for doing whatever you can naturally,
Yeah.
but if you're doing all the things and the numbers are not moving, you have to do something to protect yourself, right? Like we don't
Yeah.
have all the science and research for people to say, no, I don't want to do that, this, that, and the other. There's actual data that shows that these things can be life-saving in the right group of people. Now, do I
Yeah.
think everybody should be on them? Absolutely not. There's people who don't need this stuff, right?
Right.
But this is where, we have to get checked out for that. The other thing I recommend are thyroid tests because one
Mm.
in uh, I think I can't do math. 1 in 4 women
Hmm.
will 20 up to 25% of women will develop a thyroid disorder peri or postmenopausally,
Okay.
right? And the American Thyroid Association says that, we shouldn't be screening the general population, but we should pay attention to high risk populations, so women, right? In
Yeah.
my mind. And then people who have autoimmune disease or who've had like some sort of radiation to their thyroid or there
Yeah.
are certain categories of people that should be screened more frequently. And so thyroid tests for screening. And then, if there are any other symptoms that could be medically explained by something else, right? So for example, I have a lot of women who come in and they're really distressed because they're losing their hair, right? And how much
Yeah.
of our identity is tied up in our
Oh my
hair? It's
God,
quite a
that's
bit.
yeah, yeah.
And there's so many different causes of hair loss, right? But quick ones to screen for would be iron deficiency, right?
Mm.
And in perimenopause, when periods get more close together or they get heavier, you lose a lot of iron by that blood loss, and so women can start having hair loss from that. Dietary things like if you don't have enough vitamin D or B12 in your diet, that can also contribute to hair loss. In addition to having thyroid tests that are not within the normal range. So if you do all those labs and you have that as a symptom, you rule that out, well, your next step is to go to a dermatologist
Hmm.
because one of the things that happens is we are susceptible if it runs in your family to female pattern hair loss, right? Like, so I went to
Mm.
see my dermatologist about something entirely different, and she's a friend of mine and a little bit on the blunt side. And
Yeah.
she goes, "Girl, are we going to talk about the fact that you're losing your hair?" And I was like, I'm not losing my hair, it's stress,
Right?
okay?
This is not
She called me
happening.
out like that.
Yeah.
Yeah, but I was actually, right?
Yeah.
And we talked about it and she was like, "Okay, well, you've already had all the blood tests. Like, what does your mom's scalp look like?" And
Hmm.
my mom has thinning of her hair and it tends to run in families, right? Like
Yeah.
you'll get kind of like a thinning all up around your crown.
Hmm.
and up top, and that's called female pattern hair loss. There are treatments for that, right? That
Yeah.
the dermatologist can direct you with. So the
Yep.
thing is that like if you are having all of these symptoms, like these are the screening tests that I recommend, right?
Yeah.
The hormone tests, are they going to help? Not really, not until after your period stop, because then the estrogen will be low. The
Yeah.
hormones from your brain that signal the ovaries because they're freaking out since the ovaries aren't responding, those are high, and that's one called FSH. And then your testosterone will decline over time as well, right? So if you're having issues with low libido, sometimes testosterone can be implicated in that. So I
Yeah.
would throw in a
Yeah.
testosterone level. And there's a protein that testosterone, estrogen, and progesterone all bind to, and that's called sex hormone binding globulin. It can help interpret some of the tests. So those are kind of like the initial tests that I would do, kind of based on your
Yeah.
symptoms, and then general screening stuff. And
Yeah.
then, I always advocate for women, get your mammograms,
I was
ladies.
just gonna say, get your
Yeah.
mammograms. I mean, I was late to the party with that. I think I was
Yeah.
45 when I got my first
Yeah.
one, but I just went and got my second one.
Good
So
girl.
I'm
Yes.
gonna be on
Yeah.
my 2 year plan from now on. And I
Yeah.
got my EKG and all the
Yeah.
rest of my heart tests. And the other thing I wanted to say about that is like it's
Yeah.
awesome when they come back clean or whatever,
Yeah.
just data. Like when
Yeah.
you know, right? You
Yeah.
can do something when you have data, but also they become markers, right? So if
Yeah.
you're getting something, a screen like every 2 years or something, then you know like exactly when
Yeah.
it started. And to me, that gives me, I'm all about controlling the controllable,
Yeah.
right? So that I can let the rest go and not turn that into anxiety. And that is one of the things that made a lot of sense to me. I was like, oh, I want to get all those markers in
Yeah.
so that I know as of today, like these are all clear, and then keep them up so
Yeah.
that that way it isn't like a 5 year span when something was like happening that I didn't know
Yeah.
about, you know? So I
Yeah.
think just being proactive and taking as much
Yeah.
of your power as you can and advocating. Like you do
Yes.
really have to advocate. Like I no joke, and I love my doctor. She's been great. That's
Yeah.
why I've been with her for 17
Yeah.
years. But it took 7 emails
Yeah.
and 2 office visits
Yeah.
to get this, you know?
And
So, and I just
yeah.
wasn't going to give up. I was like, I'm about to leave the country for 2 months. I need the shit before I leave. Like,
Yeah.
let's go.
Yeah. And I think that's a statement on how crazy our healthcare system has gotten and how fragmented it's gotten. I just want to give a shout out to all of my primary care colleagues who are out there. They and the pediatricians are some of the hardest working
Yeah.
doctors
And they're
in
spread really
medicine.
thin.
And they're spread super thin, right?
Yeah.
Like I could give a whole TED talk on like insurance and
Yeah.
CMS and reimbursement and craziness and but basically there are certain variables beyond the control of the doctors who are working in the system
Yeah.
that have led to 10 or 15-minute appointments, right?
Yep.
And
Yeah.
what can you truly discuss of consequence in a short visit like that, right?
Right.
Like you're rushing to if you're like 2, 3 minutes late to get
Yeah.
roomed, you've already like blown through 70% of the appointment, right?
Yep.
So it is a very hard practice to be able to address everything. And then I think it results in people not hearing. So what I say is find your primary care doctor, be proactive about
Mm-hmm.
screening your annual physicals, right?
Yep.
My doctor,
And asking for it. I had to ask
yeah,
for every single one of the tests I just got done. I had to ask for them, even though I
yes,
just turned
go,
50 and had not
yeah.
had any of those done.
Yeah, and
I
you
had to
go
ask for
in
them.
prepared with questions, right?
Yeah.
Because the thing is that, some people will grumble about like lists that patients bring in. I actually love it, right? Because then it's like a very goal-directed conversation about like what are you wanting to get out of this visit? Let's go. Boom, boom,
Yeah.
boom,
Yeah.
boom, boom, right? And I say this, I'm in a specialty practice. I don't do primary care. I know how hard my colleagues work, and that's not always possible, but you can schedule the right type of appointment, right?
Yeah.
Like when I go into our portal for like what kind of appointment I want to schedule, you can schedule an annual physical, you can schedule a visit where you need to discuss multiple problems. They actually
Yeah.
book those for a longer amount of time. If it's a one problem visit, they're going to give you the 15-minute spot. If you
Yeah.
say I
Yeah.
got like two things, three things that I need to discuss, they'll give you a longer appointment time, right? But you
Mm.
just have to know how to advocate for yourself in those scenarios. And so, like, as soon as I finish my annual physical this year, because I know my doctor, she's amazing and she
Yeah.
books up real fast. I am already at the front desk booking my one for the next year. Even if I have no idea what I'm doing,
Yeah.
I'm going to do my darndest to make sure that I show up to that and that I know what I want to talk to her about.
Yeah.
Right.
I
So,
love this. I love this.
yeah.
Well, thank you so much, Komal, for
Oh,
all of this knowledge and and for pushing me personally to take care of my health and
Oh,
to take it
oh, I got
seriously
you.
and to just like not sit around and suffer and to know that there are options. I'm just so grateful. Can't wait till I start.
I know. You'll have to
Um,
send me some updates on
I
how you're
know.
feeling.
So hopefully we're the
Yeah.
push for all of you listeners out there to, take care of yourself. I think my
Yeah.
brother passing in the way that he did will forever be something that I'm gonna always be so, cognizant
Yeah.
of your health and taking care of your health and
Yeah.
doing all the things, and being as proactive as you possibly can and
Yeah.
taking it seriously. I think
Yeah.
it's very easy to put it to the last thing on our
Yeah.
to-do list. And you deserve more than that. Your family
100%.
deserves more than that. Your kids, your whoever's in your life, right? So do it for them. So thank you
I,
so much, Como,
my
for
pleasure.
being on. I've loved this conversation, and I'll put the links in the show notes for
Yes,
everybody.
I
And
will send
also,
you that scale too,
yeah,
so you can include that. But yeah,
and the link
thank
to
you
your
so much.
podcast too.
Oh
Her
yeah,
podcast is
absolutely.
full of
Yeah.
all women's health
Yes.
stuff.
And
So
if
there's some great
you're,
stuff.
yeah, and if you're in Washington State, I have a menopause practice that I run on one day out of the week near where I live. And it's become like my heart and
I
soul. It's
love
called
that.
Eastside Menopause and Metabolism. So come find me if you're in Washington. I'd love to.
Yes, and I'll
Yeah.
put your socials in here too because you do some
Yeah.
great reels on just quick learning so that
Thank you.
you can be educated as a woman on what your health is. So,
Yeah, I'd love
thanks
that. Thank
everybody,
you.
and until next
Bye.
time, everybody, get out there and hustle and thrive.